you know what will happen to your body if your muscle lack of protein called dystrophy? You will have muscular dystrophy. So let's take a look into muscular dystrophy. The muscular dystrophies are a heterogeneous set of genetic diseases that weaken the muscles over time, resulting in progressively more severe impairment. Before impacting the muscle more broadly, muscular dystrophies frequently start by affecting a specific muscle group. Some forms of muscular dystrophy eventually impair the heart or the respiratory muscle, which make the condition potentially dangerous. Muscular dystrophy come in a variety of forms, signs and symptoms occur at different age and has variable degree of severity. There are several types of muscular dystrophy. The most common muscular dystrophy are Duchenne muscular dystrophy and Becker muscular dystrophy. Next is myotonic muscular dystrophy, limb-girdle muscular dystrophy, facioscapulohumeral muscular dystrophy, congenital muscular dystrophy, distal muscular dystrophy, oculopharyngeal muscular dystrophy, and Emery-Dreifuss. So, what is the cause of muscular dystrophy? Muscular dystrophy is caused by mutations, which is alteration in the genes in charge of a person's muscles composition and functionality. The mutations cause changes in the muscle fibers that interfere with the muscle ability to function, leading to muscle weakness and progressive disability. The child will inherit a copy from one parent and the other copy from the other parent. If one or both of the parents have a mutated gene that causes muscular dystrophy, it can be passed on to the child. Depending on the specific types of muscular dystrophy, the condition can be a recessive inherited disorder, dominant inherited disorder, or Z-linked disorder. People with muscular dystrophy have clinical features like enlarged calf muscle. It is also common for boys with Duchenne muscular dystrophy to have enlarged calf. This is due to scar tissue build-up in muscle and muscle tissue being replaced by fat and connective tissue. Next is difficulty walking or running, heart problem or heart failure, stiff or loose joint, trouble swallowing, muscle pain, breathing problems, learning disability, curved spine, and waddling gait. The waddling gait happens because of weakness in the hip girdle and upper thigh muscle. The prevalence of muscular dystrophy. In 1916 and 2013, found between 19.8 to 25.1 per 100,000 persons per year to have muscular dystrophy. In Malaysia, around 43 newborns are affected by muscular dystrophy every year. Duchenne muscular dystrophy is considered as one of the most common lethal pediatric disorders worldwide. Is it an X-linked inherited disorder with an incidence of 1 in 3,500 live births? Duchenne and Becker estimate prevalent 1 in every 7,250 male aged around 5 to 24 years old.
Now, let's look at the pathophysiology of muscular dystrophy. It happens because of dystrophin's deficiency due to the dystrophin gene is most likely mutated in the form of deletion of one part or more, and then this will provoke microlesions because of the damage to sarcolemma whenever there is an eccentric contraction happen. That could eventually lead to massive calcium entry, loss of calcium homeostasis, and activation of CO2-dependent proteases, and then this will dysfunction the mitochondria, gives rise to an oxidative stress. Thus, muscle cells necrosis occur, and then when the muscle tissue have been unused for a long time, then the fibrous tissue begins to form in the muscle, and the body's immune system increases in inflammation. For the treatment, actually there's no specific cure for muscular dystrophy, but medications and therapy can help manage and slow the course of this disease. First is medication under conservative management. Corticosteroids, for example prednisone and deflazacort, have been found can increase muscular strength, and then Vyondys 53 may help up to 8% of individuals with Duchenne muscular dystrophy. And cardiac care, for example angiotensin converting enzyme, ACE inhibitors, ARB and beta blockers can slow the course of cardiac muscle deterioration. Secondly, therapy. Let's take a look at the respiratory assistance, for example non-invasive device where the patient receives air under pressure through a mask, nosepiece or mouthpiece. Next, orthotic intervention, for example in the picture AFOs, ankle foot orthosis for stretching or positioning during the day in non-ambulatory phases. And next, general exercises help maintain muscle functions to conduct everyday activities, for example walking and swimming. Thirdly is surgical type of management. Spinal fusion surgery permanently connects two or more vertebrae in the spine, and its function is to improve stability, correct deformity or reduce pain. For foot surgery, its function is to correct and maintain foot position as well as prolong ambulation. Moving on to the prognosis. Prognosis is varied according to the individuals. For example, some children die in infancy, while others who survive have severe muscle weakness, including loss of independent ambulation up to 13 years old. Let's proceed to the impairments and functional limitations. Impairments include osteoporosis, scoliosis due to muscle weakness, joint contractures, chest infections, may develop cardiomyopathy, and prone to being overweight, especially if taking steroid treatment. Muscular dystrophy will affect activities of daily living such as toileting hygiene, functional mobility in terms of transferring from one place to another place, problems in dressing and also feeding. This disease will also affect leisure, work, rest and sleep and social participation due to pain in movement. That's all about muscular dystrophy. Thank you.